So today we are going to cover two lymph node system, which we call them as lymph node and the spleen. Both of them are exam important slides that we are going to identify through. Now besides this particular lymph nodes and these spleen, we have another two specimen to identify as a lymphoid organ. One is like thymus and other is the skin. Skin itself is a lymphoid organ as well, like whenever you are seeing that particular lymphatics or lymph nodes present in the skin as a lymphoid organ can be considered as well. Other than this, we have some gut lymphoid organ as well as present in this abdominal cavity like appendix, like ileum, etc., etc. But we are emphasizing as a separate entity this lymph nodes and as well as the spleen. So we will go through these lymph nodes first and then we are going to cover this the spleen tissues. The theory portions of the spleen tissue is already been covered, the blood circulation of the spleen and the content of the spleen also been covered in the theory and as well as practical. I am not just going to talk detail about the spleen, only just like highlighting the features which help us to identify this particular organ whenever you are seeing this under microscope, and rightly pointed out why we are saying this particular organ as a lymphoid organ or lymph nodes or spleen. So whenever you are going to identify this particular organ as a lymph node, this particular lymph node is kind of like you are picking up this particular lymph node and slice it and stain it and see under the microscope. Now this particular lymph node have got like a thing which is called them as lymph node proper, which is the main body of the lymph node. Now this particular lymph node have got vessels, just like blood vessels, we call them as lymphatic vessels. There are two sets of lymphatic vessels or channels that communicates with these particular lymph nodes. We call this as afferent and efferent lymphatic vessels or channels. They are highly transparent, cannot be stained well. So these particular vessels we are not going to see very properly. Now the purpose of this particular lymphatic vessels is to bring this lymphatics which is flowing through the bodies to bringing through this particular lymph nodes. If that particular content of the fluid needs to be filtered by some diseases or something is bad is happening there that needs to be filtered out, then it is flown through the other system of this venous lymphatic channel system. Now this particular lymph nodes has an entry point and exit point. We call them as hilum of the lymph node. It looks like a kidney bean shaped structure. So there is an entry point, we call them as hilum, through the structure gets in and comes out through this particular lymph nodes. So this particular thing looks like this. So this is a hilum which we are talking about, where this particular lymphatic channel gets in, blood vessels and systems which gets in, and this has a capsule penetrating through this, it goes in, and after this it runs through this particular tissue of this particular lymph node. We call them as parenchyma, which can be divided into two domains. We are coming into it. Then after the filtration, these things can be just like a getting open or getting out. So inside inflow and outflow, you have got different lymphatic channels, and this particular thing is the body of the lymph nodes. Whenever you are going to see this particular microscopes, we are going to identify this particular tissue, that body of the lymph node. So we will be emphasizing on this particular tissue, we call them as lymph node itself. Now this particular lymph node, as you see, it has a covering, we call them as capsule. So this particular capsules of the lymph node penetrates through the tissues of the lymph nodes. So this particular lymph node substance, we call them as parenchyma. So this capsule penetrates, dips into these particular tissues and makes this go into, split into small lobules or subdomains of these lymphatics. So these capsules, as it penetrates through this particular substance of the lymph node, we give a special name to these capsules. We then call them capsules as trabecula or trabeculae, and the space which surrounds this particular trabeculae or this capsule, we call them as trabecular space. So this capsule, as it penetrates deep, it changes the name from capsule, we call them as trabecula. Now through this particular trabeculae, we see this, it gives it road or pathways so that these blood vessels and lymphatics and nerves and everything can flow through. Now this particular trabeculae, as it penetrates through, finds some space around, we call them as trabecular space. Now coming to the main content of this particular lymphoid organ or these lymph nodes. So this particular lymph node has an outer capsule which is present to it, which is covering or wrapping around. Then we have this parenchymas. This parenchymas can be split into two parts. One is outer side and another is central part. The central part we call this as the medulla part. The outer side we call them as cortex. So this one outer side which is closed by these capsules we call them as outer cortex, and then the inner side or central part we call them as medulla or inner medulla, outer cortex. Now this particular cortex, as you see close, they are housed by presence of nodules like this, small nodules. These are lymphoid collections or lymphoid nodules. So this particular cortex, just beneath this capsule we call them as superficial cortex, and then close to the medulla we call them as deep cortex, and then we have this particular region we call them as medulla, or doesn't have that much of lymphoid aggregates. So these lymph nodules are present under these capsules on superficial cortex. So this is how this orientation of whole thing is present. So this is all about this particular architecture of the spleen. It has a capsule, the capsule penetrates deep, goes into, we change the name of the capsule, we call them as trabeculae, find some space around the trabecule, we call them as trabecular space. Then this parenchyma split into two parts. Central part we call them as the medulla. The peripheral part close to this particular capsule we call them as cortex. Cortex may be superficial, may be deep. If you cannot remember that detail, just know the cortex. Cortex is housed with presence of circular bodies which is lymph nodules. Circular, many of them are there, we are going to identify. So to summarily, we have the capsules and we have the parenchymas. Other than this particular lymph space or lymph nodes have got one elemental thing, we call them a space. So there are some spaces that is present within these particular lymph nodes. We call these spaces as sinus. We call them as sinus. So whenever you are going to see these lymph nodes, we have the capsule, then have parenchymas. Within these parenchymas, through this particular capsule, there are some spaces there. We call them as sinus or lymphoid sinuses. There are three such spaces can be identified of. One is just beneath this capsule. So this is a capsule. Under this capsule, we find some space. We call them as this space which is present. We call them as subcapsular space or subcapsular sinus. Following this trabeculae, as this particular capsule penetrates deep, again surrounding this particular capsule or trabeculae, we find some space there. We call them as trabecular space. Again, this particular trabecula heading to the central point, we call them as medulla. This medulla is occupied by some space again. We call them as medullary space. So depending on where this particular space is lying within this particular lymph node, we call them as spaces, different regions. Subcapsular space, trabecular space or medullary space, right? So whenever you are going to see these particular structures histologically, these spaces matters to us, helps us to identify this organ and differentiates from the other lymphoid organs. So these spaces which this particular lymph node has, this is a hallmark thing. That means this is their sole identity, helps us to pinpoint this tissue as lymph node. Out of these particular spaces which we have mentioned, just subcapsular space, trabecular space and medullary space, we will emphasize only one space out here for our exam purpose, for our understanding, is subcapsular space. That means the space which is lying below the capsule and the parenchyma. So there is a tiny space which is present under this particular capsule and this particular parenchyma. So this region, this purple shadow is the parenchyma. This pink line which you are seeing here is the capsule. In between them you have these green shadows which is holding this particular lymphatic vessels traveling through. This is the space, we call them as subcapsular space. This subcapsular space, whenever you are seeing that in microscope, it appears transparent. That means looks like between the capsule and this tissue we have a gap there, which helps us to identify this tissue as lymphoid tissue. Then we are going to see these particular collections of lymph nodes like this. So these lymph nodes collections is present in all and every lymphoid organs like spleen, thymus, appendix, ileum, everywhere we are going to see these particular nodules, lymphoid nodules collections like this. There is no difference in that. But what difference matters to us is that the spaces which is present within these particular tissues over there. So, this space we are going to focus in to identify this. So, next thing helps us to clear these things. So, this is a real pictogram that what you should be seeing that. So, this is what we are seeing here is a tissue which you call them as lymphoid organ. Now, it could be any lymphoid organ taken to like it could be spleen, it could be lymph node, it could be like thymus, it could be anything. But what helps us in examinations or for us for this undergrad level to quickly pick this as a lymphoid organ is that we find this one is a capsule one. This is one thing. Then we find the second thing is this one. This is the parenchyma. Now, this particular parenchyma close to this cortex, close to this capsule, we call them as superficial part. As we go deep, we call them as deep part. So, this one we call them as cortex. This part, central part, we call them as middle. So, this particular cortex is housed by these lymph nodes which is present. But what we are going to emphasize out here, this capsule and this parenchyma, do this particular have this organ have got any space or not? This is the space I am referring to. So, under this capsule we have a space existing in only present in this lymphoid tissue. What is this lymphoid tissue? We call this lymphoid tissue as lymph node. So, this lymph node have got this space. What this space is called as subcapsular space. How this particular space look like? It looks like transparent because it contains the vessels. What vessels? The lymphatic vessels. What do the lymphatic vessels contain? It contains lymph. How do the lymph look like? It's transparent. So, it picks no stain whenever it's stained. That's why it's left like this. In addition to that, it may have some flat droplets present to it. Again, fat, it stains no stains. So, the hematoxylin or eosin which you are putting in to stain this is not picked up by the fatty tissues. Again, it becomes transparent. That is why this particular region or subcapsular space becomes pretty visible to it. So, we find some kind of space or gap between the capsule and this particular tissue. We call them a subcapsular space which is hallmark. Now, we see this particular capsule penetrating deep into it and getting in this particular region between these two nodules. Now, this region, this capsule has persuaded, invaded and gone through the air. This region we call them as trabeculae, and this region also holds a space. It is not dense. We call them as trabecular space. This trabecular space leads to another area who looks like a galaxies which is part of and different kinds of tissues are there. We do not see any collections of lymphoid nodules like this. This is the medulla. And it is occupied some space again. We call them as medullary spaces, medullary sinuses. So, 3 spaces are there, 1, 2, 3. Out of these 3, we are emphasizing only one. What? Under the capsule. Space, yes or no? Tick, then okay. Looks like lymphoid tissue, look like have space, likely going to be lymph node. Now, this particular lymphoid collections that you are seeing here has a part again. So, lymph nodules at the central part, we call them as germinal center. And then other than we have this particular outer capsular, outer this region which is active regions, which is the lymphoid nodules is there. So, from here to here is the whole lymphoid nodules. The central part which is germinal center, which have got housed by different types of lymphocytes. This marginal peripheral parts is housed by different types of lymphocytes. That's different story. We are not going to talk about those things because that dilutes this identification part, which I do not want to do emphasize on. Right now, our job is to identify this tissue as lymphoid tissue, and lymphoid tissue to be specific is lymph node. Can be identified by, it's a lymphoid tissues which is visible like this. It could be anything out of this lymphoid tissue, whichever is present in here. But how we are going to separate these things from the other one? The capsule present, which is present, penetrates this tissue, gets inside, it becomes trabeculae, and between these capsules and the parenchyma we have a space. We call this as subcapsular space, which is very much hallmark for this. That's it. We end the story on this particular tissue. Subcapsular sinus is the thing that we'll be looking for. So, whenever you are seeing the microscope, go through this particular point. Capsule present, visible, okay. Parenchyma visible, present, okay. Lymphoid nodule present, yes, visible, okay. Do this particular capsule and this parenchyma holds a space between them or not? If yes, it's definitely going to be a lymph node. If not, definitely not a lymph node, could be something else. Clear? Capsule, parenchyma, these are the two things that we have learned. This is the whole architecture of lymphatics. Apart from that, it have reticular meshwork. That means to hold this particular lymphat, it needs some kind of skeleton. The skeleton is the reticular meshwork, just like the liver tissues has got different tangential fibers going on to give the structural support to it. So it's a skeleton of the lymphoid tissue is formed by the reticular networks which is present, and other than this capsule and parenchyma, what's the hallmark for this? This is sinuses. You know what is sinuses? It's a space which is present, and this particular space is present in three different regions: below the capsule, following the trabeculae, at the medulla. So we name this accordingly: subcapsular, trabecular, medullary spaces. Out of these three, if you cannot remember, don't bother. Subcapsular space is the space we are going to identify here, right? Then this particular cortex and this particular medulla which is present in here. Cortex is filled up with collections of lymphoid nodules which is present. So this particular lymphoid nodules contains a central part which is a germinal center and contains the outer circular part which is darker stain. So this particular central part is a light stain and marginal part of the nodule which is darker stain. That's it. Whenever you are seeing this particular histology slide as well, this cortex and medulla can be identified by this cortex is dark stained, this medulla is pale stained. So this is a visible distinguishing feature that is also present between the demarcating between the how much is cortex, how much is medulla. Sometimes in case of the diseases, we do not see the medulla at all. Why? Because these lymphoid nodules grow that big, they reach to this medulla and occupy this particular space. So that's why this particular medullary space or these particular spaces are there. We call them as lymph node enlargement. In doctor's terms or medical terms, we call them as lymphadenopathy. What is that? Lymph has swollen, gone big because of the disease or higher actions required for it. So there are overproductions of the lymphocytes is going on. It needs spaces. How this expansion can be done? At the cost of compromising the spaces. In anatomy, we are going to see the normal slides that holds the normal healthy lymph nodes which has this particular architecture present. Clear? Capsule which is present to it, under to capsule, this particular space we will be looking for. Then cortex, medulla, deep stain, light stain, having this particular nodules, lymphoid nodules, central part which is deep stain, peripheral part, light stain, light pale stain, deep dark stain area, germinal center is present in the central part. So this is the whole network of the story that you will keeping in mind, identifying this as lymph nodes. Cortex, medulla, sinuses and capsule, and out of this subcapsular spaces. So this is how you are looking at. This is the whole story will be looking like this. So this is a capsule, this is the cortex and this is the medulla, deep dark stain, pale stain. If you zoom these things up, then this things comes up. Between the capsule and this, we have this particular tiny bridge tissues which is known as subcapsular sinus. So this subcapsular sinus looks transparent and this capsule digs deep, goes inside. We call them as trabeculae, and again trabeculae finds a space, trabecular space, reaches to this part to the medulla which is medullary space. So this is how these things architecture do it. How these things looks like this. So if you zoom or super zoom these things, should be looking like capsule, subcapsular space, this cortex, right? So this is how these orientations of these tissues are going on. Whenever you're going to see, try to identify this capsule. If you identify the capsule, identify the parenchyma. Identify the parenchyma, find a space. If yes, lymph node. If not, something else. Clear? From these lymph nodes, spleen already done in the class as well, or the lectures as well. So it's a kind of lymphoid organs and as well as hemopoietic organs. That means it produces the blood tissues or blood cells, and as well as it is a part of lymphoid channels or lymphoid organs as well. Likewise, this particular spleen, likewise this particular lymph node, the spleen also have got capsule. So it covered by a capsule which is present as well as in the spleen. So that particular capsules as well as covering this and goes deep into this particular splenic tissues. splitting this particular spleen into some small lobes. So the same architecture of the name is existing here. Capsule, which is known as splenic capsule. As it penetrates deep, we change the name. We call them as trabeculae, right? So this particular spleen have got same covering like the lymph node has. The spleen is covered by this particular dense capsule which is present to it. Then it is penetrating deep. We have this particular trabeculae which splits this particular splenic tissue into small networks or small lobules. Now this particular spleen is divided into two systems. We call them as this parenchyma of the spleen is split into two parts. One is known as red pulp, other is known as white pulp. So what is red pulp, what is white pulp? So this whole parenchyma is red. So we call them as red pulp of the spleen because of the high vascularity. Now within this particular red pulp there are some pockets or regions of white districts or islands. That white nodules or islands which is collections of lymphoid nodes. That's why it appears white tissues. So that particular white tissues or white collections of the cells we call them as white pulp. So basically it's a canvas which is painted white. Into that particular white regions we have some kind of dots present within, we call them as white pulp of the splenic tissues. So how these things schematically look like? It has a capsule. Then it is going into this particular depth of the parenchyma. We call them as trabeculae, which splits the spleen into smaller segments. Now this particular parenchyma dick goes inside. So this particular parenchyma can be divided of two parts. One thing is the whole canvas is red and there are small isolated regions of scattered nodules which is present, which appears like a gray or white. We call them as white nodules. So this white pulp and red pulp is characteristic thing which is present in these tissues, which is abundance of red pulp and the small scanty regions which is circular nodules of the collections of lymphatic nodules which is denoted as white pulps are there, which is present in here. Now coming back to identifying features, it has a capsule, it has a parenchyma, and now again under to this particular region we can call this as the cortex. Deep here we can call them as parenchyma which is present as medulla. Now see that this particular architecture goes inside. The same thing was there. Only thing which separates is from the sinuses or spaces. Do you see the sinuses any plentifully present in here? No. There is a tight skin appearance. Under this particular capsule, immediately after this, we have this particular parenchyma or the tissues of the spleen placed it over there. So no capsular or subcapsular space, no trabecular or subtrabecular spaces, no spaces which is present in the medulla, no medullary spaces. So this particular thing may be looking like the same, but with no spaces present inside, which appears to it like more in favor of the splenic tissues. So this particular splenic tissue can be identified by this particular capsule, tight capsule with having no subcapsular space under to it. Then it's the parenchyma, between the parenchyma capsule, no space, which can be divided into two parts, red pulp which is widely distributed and collections of the white stained areas which is the lymphoid nodules which is present scattered all over in this particular regions, and this particular white pulp or this particular regions is having something feature that we have to understand. Now see that this particular tissues we call them as white pulp. This is red pulp. Now this white pulp, you see that this is pierced by something like this. So most of them, if it's stained well, if it is presented well, we see a collections of central thing which is pierced by these arteries which is present. So there is another artery here, this is another artery there. So we have seen this particular an artery penetrating deep into the central part of this particular white pulp. So which is a kind of thing that we should be looking into this particular splenic tissue. So once you given this particular tissue, it appears like it's a lymphoid organ. So if we see lymphoid organ, we go by this particular same identifying feature. Capsule present, yes. Parenchyma, yes. Outer cortex, inner medulla, fine. Trabeculae present, okay. Space there, no. Then it likely going to in favor of no space there, and rest of the things are there, and having this particular lymphoid nodules and this particular red band canvas background is present, like going in favor of spleen. Now once you identify the spleen, look into this particular circular element, that is white pulp. In the white pulp, try to find out this particular thing which is known as the central arteriole. So this particular central arteriole piercing the central of or center of a white pulp is the hallmark again for this tissue, to separate it out from the splenic tissue from the other tissues. Like it could be like thymus tissue, it could be like tissue which is present in the like vermiform appendix, it could be present in the terminal part of the ileum, where we can see the similar kind of architecture present. So this architecture having this particular white pulp pierced by this particular central arteriole is hallmark for the splenic tissue. Clear? So whenever you are going to identify these tissues, we are going to identify this particular features which is present in it by making some judgment, yes, no, yes, and then we are going for confirmations. Yeah, this has to be this cannot go beyond like this. So whenever you are going to see this particular specimen in identifications, we are going to identify like tissues like this. So this particular element capsule we are going to identify. This capsule is blended almost with the parenchyma. We are no gap is there. Hardly you can see the capsules like this. It looks like a continuous molded structure. Looks like cannot be separated out. Then we have the parenchyma. Parenchyma is having this red background with this particular white circular elements. That means this is likely going in favor of the tissues which is not lymphoid tissues. It is going to be either this particular spleen tissue or something else. Now if it is spleen or not, we are going to take this particular tissue like this. This particular spleen, we are going to identify this as white pulp. Within this white pulp, we are going to see this structure which is the blood vessels, central arteriole or pericentral arteriole as they are or not. So which helps us to identify, goes in favor of presence of central arteriole present within this particular white pulp tissues, go in favor of this. This particular central arteriole looks like this if you just zoom it. Now this central arteriole may be present at the center, may be present at the margins, or may be present outside the margins. There are some stories out there why this is present in the center or margins or outside the margins. I am not going to talk about those things, but for us to identify, this tissue looks like this whenever I am going to see this in microscopes. So this capsule hardly can be separated from this particular parenchyma. Then parenchyma have got collections of the lymphatics. This parenchyma outer cortex, inner medulla, and this particular cortex have got collections of these lymphatic tissues, lymphoid nodules, sorry. These lymphoid nodules we call them as white pulp, which is pierced by a central arteriole at the center of it. So definitely these two tissues are different and can be easily differentiated out from each other by identifying it. We have unfortunately one slide for the spleen tissue, other one got like messed up yesterday, maybe some day before in some other class. So till we find something new, we only have one spleen tissue with us and plenty lymph node tissue. So they are projected there. Please do not move the slides. Take the picture and see these things, whether you can understand this particular difference in this. Particular thing is spill out through this. This is the fallopian tube we are seeing here. So this side you are seeing this dye is coming out, right, to the individual. This side is dye is there. In this picture as well, this time we have the dye here. Forward this side. You see any dye in here? So what you are seeing here, this particular dye is ejected through this particular birth tract, coming through this particular uterine tube, getting into this cavity of the peritoneum to this side, which is you call them as the left side of the individual. On the right side we do not see any marks. Why we are not seeing any marks on the right side, and why this is present only on the left side? Odikta? Fertilized. Adika unfertilized. Obstruction. Likely the tube is blocked. That's why dye is not passing through. This side is dye is coming out. This side is dye is not coming out. So likely because of that blockage may be there, which is present as these things, and this is intending what you are going to do. Why we are going to visualize this tract? Because we are going to see if this particular dye is put through, if it is going to the tubes, to the salpingo tubes, and eventually going into spilling over or not. So if it is spilling out, we call them a spillage of the dyes, which is coming out through this particular tube. Faint fallopian tube is seen, and then we can see this particular dye is settling down here. This side we cannot see anything which is actually coming out, and even if it is coming, the comparing with this one to this side is less or very less. So we have a chances of very good blockage to this side is open and showing these things. So what is required for us? We have to identify this particular plate, what you are seeing here. We are not going to identify the disease, of course not. So we are going to see what this tract is and what this particular dye is there and why it is there, because it is spilling out of the fallopian tube cavity to this exterior here, right? Sometimes they may ask you why this side is not there visible, but in higher classes, not in anatomy. We are going to ask you about this particular thing which is presented here. So what this particular thing is there, which looks like this tube like this is known as cannula, which is putting this particular dyes in. That is the device or the syringe which is throwing the dye inside to it. So this is how this particular thing are read whenever you are going to identify this particular special slides. There are three types of special slides which are present to us: Barium Meal, Pyelogram and Hysterosalpingography. There are several other types of these particular special slides are also there, but we have a limited resource on this, so we are showing this. Other than this, there are many of them are there. We will be studying this particular thing in books as well whenever you are studying that. But theoretically, of course, in practical purpose, we have these particular slides only to identify whenever you are seeing this particular normal X-rays. So this is all about the radiology of abdomen or abdominopelvic radiologies: general X-ray, special X-ray. Special X-ray are of three types, general X-ray only one type. Why special? Why general? We just have to give logic to it. And if it is special, what kind of special? What special thing we are highlighting? Barium, swallow or meal, or if you are going to see the kidney system pyelogram, what we have is intravenous pyelogram, IVP. In short, we call them as IVP. IV means intravenous pyelogram. The dye is given intravenous way. HSG, Hysterosalpingogram or Hysterosalpingography, which you are going to see the birth tract system.